Catherine, we're gonna have everything all the way relaxed. Beautiful. What's up everybody, Dr. Bo here, and I've got Catherine with me. This is actually a super cool story because Catherine's sister works at the chiropractic college that I went to, and she is very well educated on chiropractic care, but she's gonna share her story on what initially brought her in and the experience that she's had with chiropractic in general. So go ahead and share with the world.
Well, funny thing about it is I had no interest in chiropractic at all. My sister was very insistent that I go and get adjusted. I had no idea what that was. And so when I did, I realized how important it was for my overall health, and I've been going ever since.
Perfect. Now, one of the things that initially brought her in was some low back discomfort, and we've been having sciatica, which is essentially it's a numbness or pain that shoots down your leg. So can you share with them how long you've been experiencing that for, and how has that changed since you've started chiropractic care over this last month?
It's been about 6 to 8 months now that it's been consistent, and since I've been getting adjusted over the last month, I've noticed a lot less pain in my lower legs. I have more functional like mobility. I can exercise now, so big change.
Beautiful. And what we found was this right here. So these are your vertebrae. That's a disc. And what has happened is that Miss Catherine here has a spondy, which is a spondylolisthesis, which is essentially the slipping of one of these vertebrae going forward. And it's kind of hard to demonstrate on here, but essentially instead of it lining up properly, one's going forward compared to the other, and that can pinch on the nerves. And those nerves go all the way down your legs. So what we're gonna do is we're gonna give her an awesome adjustment, get some motion into her spine, and get rid of that sciatica and that pain. So, Catherine, let's go and get your face down for me, please.
All right.
What we always start off with is the visual aspect. Now, what I'm noticing is this right leg is rotating in this way, and in addition to that, I'm seeing some rotation upper left side, and in her thoracic spine, you can tell that there's right side rotation occurring there. So, what we want to do is just pick up on as many clues as we can. Her legs are basically even. Maybe there's just the slightest amount of leg length discrepancy in the first position, and they're gonna be even in that second position. Catherine, any discomfort with this motion right here for you?
No.
Perfect, let's let that relax all the way. So the biggest thing that we feel for is motion and any discrepancies that we feel throughout the pelvis or the lumbar spine. Now, one of the very first things I notice is this her right side SI joint. There's rotation occurring there and restriction, which is causing an imbalance right here as well. So first thing we're gonna test, I'm gonna place my hand right here. Keep this leg as straight as possible, lift it up as high as you can. Perfect, back down, and then right side, back down. Catherine, what did you notice with those two motions?
The right side was a little shaky.
A little shaky. Now, one of the things that I noticed as well is that you're having to rotate your body, put more weight on one side in order to lift that up. And it shouldn't be that way, so we're gonna retest that as we get you adjusted. Now, the main thing that we're gonna adjust here is gonna be this lower right side SI joint. We wanna get as much motion to that. And I know where her spondy is, and there's very little motion that's occurring in left rotation, left lateral flexion. So those are two areas we're gonna address. We have right around T11, T12, right in this region, there's some restriction that's happening. And I believe, what was your cervical x-ray looking like? What did we notice there? So we're supposed to have this beautiful curve in our neck. Hers is going the other way, and that's gonna cause a lot of restriction and tension in the mid-thoracic region, lower thoracic region, in addition to this area here. So is there any tenderness for you right here?
Yes.
Woo! Okay, so these traps, they feel heavy, tense. Poke yours if it feels like that and you have a job where you're behind a desk. The likelihood is that over the course of the years that you're losing your natural curve, creating something like that. Catherine, let's get you adjusted.
All right.
This side up facing me, please. So we're gonna go ahead and relax that all the way. We're gonna focus on L5 right here. Breathe it all the way out. Nice. Wow. That needed to move. Go face up for me. Big deep breath in. And then right there, we're gonna let it all the way out. Wow. One more, just a little bit higher. Beautiful. We're gonna make you a little bit taller, because who doesn't want to be a little bit taller?
I need that.
Everybody needs that. This side facing me. All right, we're gonna get some awesome motion right into this lower sacrum. Breathe it out, breathe it out. Yes. Wow. Face up. Now, one of the big things that we'll talk about with her is extension exercises. If you know that your curve isn't going the right way, you want to practice having your head back. And what I feel here is tension from the base of her neck all the way up and lower down on this left side as well. So there's a few areas we're going to open up. We're going to focus on C7 on this side, somewhere around C5 on this side here. So Catherine, we're going to have everything all the way relaxed. Beautiful. And then one more right there, all the way relaxed. Nice. I'm going to traction that a bit. Whew. Bonus release. That's going to make you taller for sure.
Awesome.
Now let's go face down. We're going to go ahead and retest that sacrum. And we're going to see how things feel. Perfect. All right. So still a little bit of rotation there. All right, so that is moving a lot better. There's a little bit of this restriction that's still persisting there. I'm gonna keep my hand right on over here. Let's lift this leg up as high as you can. Perfect. Other side. Awesome. Catherine, what did you notice?
A lot higher.
A lot higher, yes. Come on up. I think you're well adjusted.
Yes.
Tell the world, what is it that you love about chiropractic? What is it that you love about coming to our office here and seeing Dr. Bo?
So, thing I love about chiropractic, it is not just for pain management, it's for overall health and wellness. So everyone benefits from an adjustment. Go get one.
Yay, thank you. You're amazing.